How to lose weight fast, 9 scientific ways to drop fat. Methods of weight loss that scientific research supports include the following. 1. Trying intermittent fasting. Intermittent fasting, IF, is a pattern of eating that involves regular short-term fasts and consuming meals within a shorter time period during the day. Several studies trusted source have indicated that short-term intermittent fasting, which is up to 24 weeks in duration, leads to weight loss in overweight individuals. The most common intermittent fasting methods include the following. Alternate day fasting. Trusted source, ADF, fast every other day and eat normally on non-fasting days. 2. Tracking your diet and exercise. If someone wants to lose weight, they should be aware of everything that they eat and drink each day. 3. Eating mindfully. Mindful eating is a practice where people pay attention to how and where they eat food. This practice can enable people to enjoy the food they eat and maintain a healthy weight. Trusted source. 4. Eating protein for breakfast. Protein can regulate appetite hormones to help people feel full. This is mostly due to a decrease in the hunger hormone ghrelin and a rise in the satiety hormones peptide E, GLP-1, and cholecystokinin. Trusted source. Good choices for a high-protein breakfast include eggs, oats, nut and seed butters, quinoa porridge, sardines, and chia seed pudding. 5. Cutting back on sugar and refined carbohydrates. The Western diet is increasingly high in added sugars, and this has definite links to obesity. Trusted source, even when the sugar occurs in beverages. Trusted source rather than food. Refined carbohydrates are heavily processed foods that no longer contain fiber and other nutrients. These include white rice, bread, and pasta. These foods are quick to digest, and they convert to glucose rapidly. Excess glucose enters the blood and provokes the hormone insulin, which promotes fat storage in the adipose tissue. This contributes to weight gain. Where possible, people should swap processed and sugary foods for more healthful options. Good food swaps include whole grain rice, bread, and pasta instead of the white versions. Fruit, nuts, and seeds instead of high-sugar snacks. Herb teas and fruit-infused water instead of high-sugar sodas. Smoothies with water or milk instead of fruit juice. 6. Eating plenty of fiber. Dietary fiber describes plant-based carbohydrates that it is not possible to digest in the small intestine, unlike sugar and starch. Including plenty of fiber in the diet can increase the feeling of fullness, potentially leading to weight loss. Fiber-rich foods include whole grain breakfast cereals, whole wheat pasta, whole grain bread, oats, barley, and rye. Fruit and vegetables. Peas, beans, and pulses. Nuts and seeds. 7. Balancing gut bacteria. Some foods can increase the number of good bacteria in the gut, including 8. Getting a good night's sleep. Numerous studies have shown that getting less than 5 to 6 hours of sleep per night is associated with increased incidence of obesity. Trusted source. 9. Managing your stress levels. Stress triggers the release of hormones such as adrenaline and cortisol, which initially decrease the appetite as part of the body's fight or flight response.